If you've got health care already through the job, then what we do is work with your employer to lower your premiums by up to $2,500 per family per year. If you don't have health care, then what we're going to do is we're going to set up a pool, a system that is similar to the one that I benefit from as a member of Congress. I'm a federal employee, so I'm part of the big federal employees pool. Since there are millions of people involved in that pool, it means that you can drive down, you can negotiate and get really good rates, which is hard to do for a company that only has 50 employees or even 500 employees. And you will be able to buy into this plan. There will be no exclusions for pre-existing conditions. We will emphasize prevention so that you're getting primary care and checkups and screenings. And if you can't afford it, then we will subsidize you so that there will not be a single person in America who wants health insurance that won't be able to get it. And we will also crack down on insurers so that the practices that they engage in, for example, denying claims for people who have been paying their premiums, but some of these insurance companies have gone out of their way to avoid making payments. We will be cracking down on that. We'll also be negotiating with the drug companies for the cheapest available price for drugs. Now, it's going to be a challenge getting this passed because we've been talking about this since Harry Truman. And part of the reason that we don't get it done is, we saw the drug and the insurance companies over the last decade spend $1 billion in lobbying, campaign contributions to prevent the kind of reform that's needed. So part of what we're going to have to do is to push back against the special interests in Washington. We've got to build a movement and a mandate for change at a grassroots level. Your voice has to be added to the voice of all the folks out there who are going without health insurance, 47 million people, as well as those who are recognizing that increasingly it's getting harder and harder for them to keep their health insurance.